St. Clair County residents that have been tested at all of the available testing sites.
Well, and again, Sam, as we've been talking about, and I know you've been following the feeds every day, the briefings, we've been telling everybody it's going to be going up, and that's sure what's happened.
It is. If for anyone that listened to the governor's call that just finished, Dr. Ezike had said that our numbers are expected to go up, and we are seeing them go up, and we will continue to see them go up for a little while longer.
Okay, very good. Thank you. At this time, I'd like to introduce to you the chairman of St. Clair County, Chairman Kern. Chairman, thanks for joining us again today. Appreciate it.
Thank you, Herb. I appreciate you doing this every day at 3:30. An increase in 3 positive cases. It's what people expected. It's not what we want to hear, but it's the honest truth as to what's going on. At this time, we really would like to thank our doctors, our nurses, our medical professionals, our EMS people, our dispatchers, people that are out there on the front lines. They're the ones that are putting their lives on the line and working for us. Let's make sure that we thank them and that we're respectful to them if we have to visit them or see them or be involved with them. Their job isn't an easy one right now. They're leaving their families at home. They're coming out and they're doing their work, and we do appreciate their fine work. Also, our hospitals, we're lucky to have Memorial BJC, St. Elizabeth's, and Touche Regional that are all doing great work right now. We need to remember those institutions and the fact that they are also out there on the front lines, and how lucky we are to have them in this county. We've had representatives from Memorial BJC, actually 2 that have been on our live feed. Coming up in the near future, we'll have a representative from Touche coming here, as well as someone from St. Elizabeth's will come on the program and make sure that everybody knows what's going on specifically in those hospitals. It's a difficult time for all of us. We are staying at home, and we've got our kids at home. We're going to keep our kids home. We're going to keep them safe and germ-free during this time, but there isn't a whole lot for our children to do. And so coming up in a little bit, I'm going to detail what is being done in the county to make sure that life is interesting for our children. But before we do that, I'd like to welcome from the Eastside Health District, Elizabeth Patton-Whiteside. Elizabeth is the Executive Director for the Eastside Health District, and Mila Blanford, the Assistant Administrator from the Eastside Health District, to talk to us about what they're seeing in their part of the county and in the health district and in the county altogether as to what you think the response has been and what the response will be to COVID.
Well, Chairman Kern, thank you for inviting us up to be on the broadcast today. As the administrator of Eastside Health District, I would like to inform you of the jurisdiction that we cover, because it seems to be a little confusion about it. Eastside is responsible for approximately 60,000 residents in St. Clair County, which includes the 4 townships of East St. Louis, Canteen, Centerville, and Stites. We are working diligently with the local and state officials, including St. Clair County Health Department, to help stop the spread of the coronavirus known as COVID-19. We follow the guidance of the Illinois Department of Public Health and CDC. Our offices are still open, we will remain open, and we are here to serve the public. I have some of my team here with me today to inform you of the jurisdictional statistics for our area and the operational changes. I would like to introduce Mila Blanford, my assistant administrator, who will give you the situational update, followed by Bhagia Kohli, our WIC director, who will give you our operational changes at Eastside Health District. Mila.
Good afternoon. Of the 77 individuals tested within St. Clair County, 3 of those reside in Eastside Health District's jurisdiction. 2 have pending test results and 1 has been negative. It does not mean that we do not have the illness in our community. It just means that we have not picked it up with testing. So we do urge our residents to heed all of the precautions and guidance that is out there. Both health departments have been receiving calls from private providers and urgent cares, as some of the private labs are now providing testing supplies. These providers are contacting the jurisdictional health department for each of the patients that they are testing. So know before you go. Please know which health department that you belong to. Again, Eastside Health District is East St. Louis, Centerville, Stites, and Canteen Townships. If you've been tested for coronavirus at one of these sites, you may be contacted by your local health department. We ask that in the meantime that you and your close household contacts remain at home. We will follow up with you regarding testing, your results, and next steps. Similarly, if you are ill, we ask that you and your household contacts stay at home, that you're not out in the community. If you are symptomatic and at home, we ask that you still practice social distancing within the confines of your household, because you do not want to spread it to other individuals in your house. So we ask you stay at least 6 foot away from individuals. No sustained contact. If you wish to seek medical attention from a provider, we ask that you call ahead, because each clinic has its own protocol on how they accept patients. Following these guidelines will help keep you and your family and your community safe.
So Mila and Liz, when we give our numbers every day, we do a St. Clair County update. You are coordinating, and we are coordinated together with the St. Clair County Health Department, that when we report numbers, that number reflects Eastside Health District and St. Clair County Health Department numbers added together, right?
Correct.
And we appreciate that coordination. In what other ways are we coordinated?
Mila?
Well, we have different operations that we have reduced operations for both health departments. One of those areas is through WIC, but they do work together. We're having similar responses through our WIC program, and I believe representatives from both health departments will explain those. As far as emergency preparedness, though, our staff, as well as St. Clair County staff, is within constant contact to know what's going on in the community, because disease doesn't know a border, so it doesn't know Eastside versus St. Clair's jurisdiction. So I think that hourly contact is so important, so that we keep sharing that information.
And when St. Clair County gets any type of information, they make sure that we have the same information, and we reciprocate, because sometimes one person or the other may be overlooked. So we want to make sure that we're all on the same page, we're all doing the same thing, because we are each other's backup. So if they need help, they call us. We need help, we call them, and we work together.
Shelter in place is throughout the entire county, Eastside
Yes.
Health District, St. Clair County Health Department. We appreciate your efforts in helping us, helping all the health departments fight COVID, and together we'll get through this.
We sure will. Just stay safe.
Okay, thank you very much. So as Mila and Liz alluded to, we're going to welcome Bhagya Kohli and Kathy Weisenstein. Bhagya is the WIC coordinator at the Eastside Health District. Kathy Weisenstein is the WIC coordinator at the St. Clair County Health Department, and they're going to talk to us a little bit about the WIC program and some changes that have taken place, and exactly how people can access these benefits. Who's going first? Bhagya?
Yes.
Great.
Thank you.
Thank you. Welcome.
All WIC offices operated by Eastside Health District are still open, and we are providing services. We are encouraging all participants to call the office before you come, because their process has changed. The state has given us permission to exempt the requirement of physical presence at the WIC office for all the participants, as the disaster presents a serious health concern. The WIC certifications and recertifications will be completed by a telephone interview, which can take up to 30 minutes. The required measurements and the blood work are waived for 90 days. So when you approach the WIC office, call us, and we will walk the WIC checks out to your car, and we will explain everything via telephone. And also, we have made some changes to the hours of some of our WIC offices. Our Cahokia office is only open Monday through Wednesday, and our Fairmont City office is open Thursday, Fridays only. Our East St. Louis clinic is open Monday through Friday, 8 to 4:30. So please do call us so that you are served when you come to our for the WIC checks. And CDC has given some guidance on breastfeeding for our moms during this crisis. breastfeeding is the best way to feed your baby, but it protects the newborns from illnesses, and also it's very effective in against infectious diseases because it strengthens the immune system of these babies by transferring the antibodies from the mother to the baby. But we are giving you some guidance on if you are in an infectious state or you have been diagnosed with COVID-19, please speak to your healthcare provider on what to do. But in the meantime, please wash your hands before you touch your baby. Also, wear a mask and when you're nursing the baby. Please, if you're pumping your baby, wash your hands and also wash all the bottle pots, and the pumps before you handle everything. If you're giving your baby express breast milk, if you pump and give it to somebody, have somebody who's well and who can feed the baby for you. And our peer counselors are available to provide any assistance and support during this time. Now, Kathy can talk about how it's going on in Belleville.
Hi, thank you, Collie. Yes, Belleville is very similar to the way Eastside is running their clinic. So if you're new to WIC, you can call either clinic. We have the other townships that Eastside does not serve in St. Clair County. So when in doubt, call either clinic and we'll get you to the right place. St. Clair County Health Department is also open for all services by appointment only. We are also doing interviews for enrollment and for nutrition counseling via the phone. And then we also have the curbside pickup so you can pick up your coupons. We also have all the wraparound programs that go with WIC available. We have your case managers on staff that you can call in and ask them questions for our high-risk infant program and for our high-risk prenatal program, Better Birth Outcomes. We are also giving immunizations at this time. So if you have any questions about our services, call us. And if you are in need of our services, please call us and we'll direct you on how to get that appointment completed.
And Eastside is also still helping with the diapers for the community. So if you're in need of diapers and you're a WIC mom, please call us and we will get the diapers out to your car. Thank you.
Okay.
And they can call either department to find out if they're eligible for your
Yes.
programs?
Yes, they can.
And we encourage people to make that call
Yes.
Yes,
if
we
they're
do.
in need.
We do.
So, thank you both very much for being here today. We sure appreciate your information. So as we discussed earlier, a lot of our kids are home and they're being educated at home, and many are bored. And we're very fortunate that Susan Sarfati from the Regional Office of Education has provided us a link on their website, which is www.sccroe50.org, to a lot of free resources to use with students during school closures. Everything from storybooks online to mystery science academies to yoga education on a YouTube channel, kids activity blogs, as well as information on coronavirus, on guidance during this epidemic. All of these things are available. They're free. They're online, and they're available by that given website. Once again, www.sccroe50.org. So I encourage you to go on there. It's a pretty neat website, and actually was pretty interesting to go on there, even though I'm a little older than some of the age category that they're mentoring to. At this time, I'd like to welcome to the table Dr. Janet Linton. Dr. Linton is a veterinarian and animal control administrator, and she's here to talk about a few issues. As always, with communication and with all the information that's out there, there is some misinformation about the coronavirus and our pets. And so maybe today you could help us and talk about response with our animal community to this virus.
Yes, there is a lot of misinformation out there. So there was some news bites about a dog that was in Hong Kong that was tested, and there was some nasal swabs that tested for coronavirus, but that dog has remained in quarantine and has not become ill. So that is the only dog that has tested positive at this point. Nobody in the United States' pets have actually become tested positive. The AVMA, the ISVMA, the many of the veterinary medical association groups are talking and discussing about if you do come down with coronavirus 19, that you actually have someone else take care of your pet for you. There is not a need for any panic in that you cannot have your pets, but I don't recommend if you are ill to kiss your pets. There is still veterinarians providing services to prevent other communicable diseases such as, rabies and so forth, and the AVMA recommends that we still do that. Some of the people may be aware that there is a coronavirus in dogs. That coronavirus is not the same coronavirus that is in people. There's actually many different types of coronaviruses along the animal fields. Coronavirus is just a subcategory of a species of viruses. So don't be mistaken that the coronavirus that is associated with people is also the coronavirus that is with pets. So there's some misinformation out there that the vaccines that we have for coronaviruses for pets would work on people, and that is absolutely not true. So the CDC, the ISVMA, the AVMA, all of them are working together to kind of calm some fears that are associated with coronavirus. And so I would recommend that you look at those sites if you're looking for factual information.
Do you think this is a good time to adopt a pet from your local adoption center, since people are home and they're looking for something to do that may provide them a good avenue to be able to house train or get a new pet acquainted to the home environment while they are home?
It is not a bad time, but there are some restrictions now being made from the Humane Society at this moment. I know of the one over in St. Louis, they are restricting adoptions at this particular point. The only reason why they're doing that is, I guess, to limit public access to the building and so forth. But I would be mindful adopting a pet, which is not a bad idea to foster a pet or take care of a pet, is that you keep in mind that hopefully when we can get control of this coronavirus, that our lifestyle is going to change. And so we hope that happens soon, but keep mindful that you would want to keep those habits so that your pet can transition easier as well.
So during the difficult economic times that we're seeing, a lot of people have lost their employment. The food pantries are stepping up, and many of them are asking for donations of dog and cat food and other supplies to make sure that when the home environments are don't have the money for those anymore, that they are available through the food pantries, as well as food for people. Our pantries are asking for that all the time. You are always very generous at the Belleville Animal Clinic with the St. Clair County Animal Services. You encourage that too, I would assume?
Yes, I would encourage that. I know that we've had some people that can't find our dog food at the pet store at this particular point, and unfortunately, as we know, the supply chain is not limited, but people tend to hoard a little bit more, worried about that supply chain. The supply chain's still out there.
Well, anything you'd like to add to tell people during this this virus epidemic, pandemic?
Not that I can think of at this particular time, but I do have information for both of you and Barb Holt too about the CDC's recommendations, AVMA and ISVMA recommendations at this point.
Great, and we'll post those on our EMA website for everyone. So, Dr. Linton, we sure appreciate you being here and
thank you for inviting me
and answering questions today. Thank you, Herb.
Well, thank you, Doctor. We appreciate you coming in. As I said earlier, we have had a lot of information to get out there to you today, and hope you found it beneficial to you. Just a few other things, what our day has been like today. Here at the EMA office, we started off with our weekly conference call with the mayors of all of the communities in the county. It was well attended. I want to personally thank each of those mayors or their designated person that was on that call with Chairman Kern and myself and the staff. Then we went from that into a conference call with our first responders. You heard Chairman Kern talk about our firefighters, EMS, our telecommunicators, the law enforcement, trying to keep everybody together. You heard Mila a little while ago say everybody is stepping up, working together. The health departments are working together, and I think that's what we're trying to do, is to keep all of our partners informed and keep them updated to each and every step of the way on this. After that, we had a conference call with the governor's office that was well attended. Over 1,000 people were on that call. The governor was given does it twice a week for the chairman's office and throughout the state. Some other information, hopefully as we're sitting here right now, some of the PPE equipment is being delivered. We want to thank our state representatives who worked last night with Chairman Kern to kind of push those buttons a little bit more. So hopefully the agencies that were on the call this morning will be sending out an email to you either later tonight or tomorrow, letting you know when you can come and pick up some of that items, along with hopefully tomorrow the hand sanitizer that we talked about the last day or so. It's supposed to be here as late as tomorrow night or Thursday. So we'll be calling those agencies that has put in a request for them. You heard the numbers went up again statewide and up in St. Clair County. And, we keep telling you, social distancing, stay home, don't go out. If you have to, get back home, go to the store. We get calls here all day long. Well, I'm out of groceries. Can I go get groceries? Yes, you can go to the grocery store. But that doesn't mean you get to stop along the way and go play at the park. Please stay home. If we are going to stop this, it starts with you. Each and every one of us. We have to stay at home when at all possible. We're going to be back here tomorrow afternoon at 3:30 with an update. I can't tell you if the numbers are going to go up or down. I hope they stay where they are. But we will bring that information to you, and we'll be back in just a few moments with our ladies to translate this to our Spanish communities. Thank you.